Hey guys, welcome back to my channel, The ENT Resident. Today we'll be doing a short discussion on a very important Viva question that we get when we get a case of chronic tonsillitis, and that is the grading of tonsillar enlargement. You can also now purchase my notes. I have added the links in the description. Okay, so let's talk about the grading. So the grading that we follow usually is the Brodsky's grading of tonsillar enlargement. The Brodsky grading system is basically a system that is used to classify the size of the tonsil based on the percentage of the oropharyngeal airway which is occupied by the tonsils. We can divide it into 4 grades. Now let's talk about each one of these grades. So coming to grade 1, before that let's talk about grade 0. Now grade 0 is when the tonsils are entirely seen to be present within the tonsillar fossa. You can see in the image, these are the tonsillar fossa and the tonsils are present entirely within it. Next is grade 1, when the tonsils occupy less than 25% of the oropharyngeal width. So this is the oropharyngeal width, and you can see the tonsils over here. They are occupying less than 25% of the oropharyngeal width. In this case, there is a very minimal airway obstruction seen. Next, coming to grade 2, the tonsils are occupying 25 to 50% of the oropharyngeal width. You can see in the image over here, the tonsils are much larger than the previous one. And in this case, the patient may have a very mild airway obstruction. Grade 3 is when the tonsils are occupying 50 to 75% of the oropharyngeal width. In this case, the patients have moderate airway obstruction. You can see in the image over here that's actually taking up more than 50% of the oropharyngeal width. And grade 4, the last one, is when tonsils occupy more than 75% of the oropharyngeal width. And in this case, the tonsils are sometimes also known as kissing tonsils because they're almost touching each other, or at sometimes they're actually touching each other in the midline. So that is why they are known as kissing tonsils. And in these cases, the patients will complain of a severe airway obstruction. So these are the grades of tonsillar enlargement. This is something you have to know whenever you see a patient with tonsillitis coming to you, and there is some clinical significance to it. This grading system will help you in understanding what is the degree of airway obstruction that the patient could be experiencing, especially in cases of pediatric obstructive sleep apnea cases. And this will also help you in trying to make a decision whether you need to perform tonsillectomy in the patient or not. So that's all about this topic. If you have any further questions, please note them down in the comment section and I'll get back to you.